Hi viewers and my dear students, hope all are fit and healthy. I am Mrs. Nima, again coming on a live section today. Hope you all are fine. I welcome you in our channel rgcsk.edu. You all very well can watch this live class on our channel. So today section will discuss about autism. What is the meaning of autism? What is the definition? What are the causes and predisposing factor? What what are the clinical manifestation? What are the examination, treatment, and nursing management and nurses role? Very well, you all know today what is the day. Today is the day of Autism Awareness Day. So all over the world, all the medical and paramedicals, we are celebrating as World Autism Awareness Day. So all the child in this world is gifted by the God. So the autism child also gifted by the God. So as a nurses, we have to take much care in the taking care of autism child and giving education for the family members who are all taking care of the autism, because the family members will have more frustrations and guilt about this autism. So autism, it is one of the childhood psychiatric disorders that affects the development of communication, social interaction, and behavior of the child. So today in this World Autism Awareness Day, the theme is, you can all see in the board, that is inclusive quality education for all. Inclusive quality education for all. Through the globally, we should not inequality in the care or the education or the interventions that we are providing for the autism children. The accessible intervention has to be reached for all the level of the autism children and their family. They should not have any stigma in the society. And proper awareness has to be reached about the autism at the peripheral level itself. So they should not have any inequalities of giving interventions or educations for the autism child. That is the main theme of this World Autism Awareness Day. So here, autism child should be taking care much conscious and much patience while taking care of an autism child. As a nurses, we have to be involved in the awareness day, and we have to give so much information to the worldwide and in the hospital or in the community regions for who the family members, the children, they can early identify what are the signs and symptoms of autism. So you all know autism is not a curable disease. The whatever the problems, that is the lack of communication, lack of behavior, lack of or disability of the social interactions can be managed, but it cannot be cured. So early when the family members, they are diagnosing the signs and symptoms of autism child, they can limit the disability when the child is growing, and they can prevent the control of the disabilities in their future period. So as a result, we have to give more awareness to the peripheral region, early identification of signs and early diagnostic of autism child, and early provide interventions or educational strategies for the autism child in order to improve their disabilities in communication and social interaction and their behavior modification. This can be helpful for their quality of life, not only for the autism child and for the family members also, or the caretakers of autism. So here we'll discuss what is the meaning of autism. Autism came from the Greek word that is known as auto, mean self. The child is isolated with himself or herself. Always they have their self world. They will not mingle with others. That is the main terminology of autism. Auto means self, self isolation of the child. And history, if you see, this was given by Leo Kenner. The word was coined as autism he has given as disabilities of emotional and social uh, behavior of the child. Later in 2013, DSM, they have psychiatric, that is the mental health disorder classification diagnostic criteria. They have coined it as autism or autism spectrum disorder. And before that, different types of autism are there: Asperger's autism, red autism, that is mainly affecting the females, and pervasive developmental disorder. Nowadays, this has been termed as autism spectrum disorder. They have group of disabilities in communication, social interaction, and behavior. So these symptoms we can early identify from the child. So when the child in the age group of toddler, 2.5 to 3 years, we can early recognize the symptoms. If we are early recognizing the symptoms, we can treat it very easily to manage the disabilities. And sometimes the child can get the symptoms in within 10 years of age also, that in the childhood period. That is known as childhood autism disorders. Next, we'll see what is the definition of autism. Autism is one of the childhood psychiatric disorder that is characterized by development problem expressed as delay in communication, delay in social interaction, and delay in behavior. That is the disability of the communication, disability of the social interaction, disability of the behavior of the child. So this mainly we can see from the definition. So they will have some of the behavior of repetitive and stereotype activities or behavior for the child. Once the behavior they are like, that behavior will be used for frequently, that is known as the repetitive or stereotypic behavior. That commonly we can see this type of autism child. So you can remember the definition as autism. It is one of the childhood psychiatric disorder that is known as developmental disorder, mainly disabled or disabilities of social interaction, communication, and behavior of the child. And American Psychological Association has described this autism as one of the developmental disability mainly caused by a problem of central nervous system. If any brain function is affected, like that also the child can affect the autism disorder. Next, we'll see what is the incidence of autism. Autism, when you see the autism among the gender, most commonly we can see 4 times severely boys can affect than the girls due to the genetic expression. And here upper socio-economic class groups can happen the autism disorder. And this autism disorder, it is a very rare disorder in the worldwide, but in US and all we can see 1 in 64 cases the child is affected with autism. And in India, 1 in 150 to 1 in 500 child will be affected with autism. So autism age group, that is within 2.5 to 3 years of age group or within first 18 months, we can early identify the signs of autism. If the parents are really aware, the age group within 2.5 years, we can identify the symptoms of autism. If it is coming late, it is late childhood autism disorder. Next, when you see the autism, we will see what are the causes and predisposing factors of autism. Causes, generally the causes is unknown etiology. What is the main reason? We cannot tell the main reason of autism. Still the researches is going on. Next, we can coin in different factors. One is environmental factors. Prenatal period or intranatal period. When the woman during the pregnancy, if she is exposure to certain stimulus, the women having any bleeding disorder during the pregnancy or during the labor period, this can cause anoxia to the fetus, and the brain functioning can be affected. As a result, future the child can affect autism. and the women have any intake of drugs during pregnancy, and she have the habit of any smoking, alcohol, exposure to radiations. If the women have any history of rubella viruses during pregnancy. So these some of the environmental factors that can affect for the development of the child. And the child having some encephalitis, or the child is having meningitis infection, tuberous sclerosis like genetic type of disorder. So these are the some of the predisposing factors that can leads to autism cause. And another one is genetic factor. If genetic expressions having autism features, in future generation also they can get the autism. And some gene problems like chromosomal abnormalities of Down syndrome, Fragile X syndromes, these children are risk for getting the autism behavior. And family history, like men in a family having autism, so that family history they have the chance for getting autism child in their future period. And these are the major causes for getting autism. Here, next we will go and discuss with clinical manifestation. What are the clinical manifestation for autism? In the definition, developmental problems caused by disability of social interaction, disability of communication, disability of behavior. So we can group the symptoms also under these factors. First one is disability of social interaction. So all the human being, we are socially interacted with each other. Then only we can live in this world. The child will have difficulty in social interaction. So as a parent, early itself, they have to identify the signs. First one is lack of social smile. The child doesn't have any social smile with the mother or father or with the siblings or with the grandparents or with the friends, and doesn't have any eye-to-eye contact. They don't have any eye-to-eye contact with the parents. And next, they have lack of expression. So when we need to have an expression, we need to have an eye-to-eye contact, we need to have a social smile for social interaction. So these three things will be absent for the autism child or lacking for the autism child. Lack of expression, lack of eye contact, lack of social smile. And they will be always self-isolated. Self-play will be there. They will not have any group play or sharing of toys. Like that habit will not be developed for the autism child. And they will be detached with the parents. So detached with the parents, mainly the mother is coming and touching the child or hugging the child, kissing the child. They will not be much expressive or lack of touch or parent attachment for the child. So these are the commonest symptoms we can see in the impairment of social interaction. So they will not involve with the social type of fun, social type of play. So they will not understand the social interaction itself. So these are the some of the clinical features. Next one is communication disabilities. What are the clinical manifestation comes under communication disabilities? In the communicable disabilities, we can see through verbal and non-verbal communications. Both will be affected for the child. Verbal communications, if we are calling the person by the name or do something, the child will not be response. The child will not be communicated. Sometimes the child will be having imitations of the words that his parent is telling. Or if anybody is telling good morning or good night, repeatedly the words will be told by the autism child. Repeated phrases will be there. That is known as echolalia. Stereotype speech will be there. Stereotype words or phrases can be told by the autism child. And some mannerism can be taken by the parents or the relatives or from the siblings. That mannerism can be expressed repeatedly through the vocal sound or through the phrases by the autism child. So these are the communication disabilities. And main thing, they don't have speech. They have the lack of speech, lack of language skills. Lack of speech and lack of language skills will be there. Whatever language they are speaking, they are not able to speak in proper way. They cannot phrase the words. They cannot communicate to the parents, especially the mother, father, or the siblings or the grandparents. Those who are with the autism child, they can easily recognized in the 2 to 3 years of age group. So these are the disabilities of the communication. And third one is disability of behavior, how the clinical manifestation will be. Behavior, the child will have stereotype or repeated type of behavior. They will be always self-isolated. They have the likeness or sameness of some activities or some work. Say for an example, when they are playing, they will be playing with the same toys in same manner. If they are arranging the blocks in the same color or in the same line, same type of play only the autism child will be doing. They will not change the style of play or change the type of toys. They always like the same type of play and same type of toys. If some parts is misplacing or some colors is misplacing, they'll be getting the aggressive behavior or compulsive behavior for the child. That we can see very perfect in the autism child behavior. So sameness or likeness of the play. So different type of behavior or patterns we can see, like visual. Sometimes they will be seeing shadows of the tree or one particular object they will be seeing for long period of time, not for 5 or 10 minutes, 1 hour, 2 hour, 3 hours. So like that they will be monitoring. Then they will have olfactory patterns, like they have the sameness of smell, particularly of same type of scent. So they have used to that type of scent only. They like that only. Then next one is taste. Same type of food. They want only the same type of food. Any different or alternative food the parents are giving, they will be dislike. They will be aggressive. They will be not taking the food. So like that behavior will be there. Tactile. So same type of sometimes rough pillows or soft clothes they will be touching. Always they will be touching the same type of cloth only. So that also one type of behavior of the child. And walking, repeated standing on toes and walking. So like that repeated type of behavior will be there for the autism child. So when the parent is monitoring, they can see it very clearly. And another one is physical pattern of behavior will be there. Physical pattern of behavior like head banging. They will hitting the head on the floor or the grass or the wall, or when they are sitting on the chair, they'll be hitting the head. When they are hitting this head, sometimes the child can get, sometimes mostly they can go with problematic self-injuries can be happen for the child. And body spinning, hand flicking, clapping of the hands, movement of the hands, movement of the upper and the lower limbs. So they will be expressing their anxious. So like that. And lack of empathy for the child. The child will be having aggressive and compulsive behavior. So these are the repetitive type of patterns, maybe of visual, tactile, olfactory, type of different type of pattern of behavior we can see. Sameness of behavior, likeness of behavior we can see on the autism child. So when the mother or the father or the siblings or the any relatives, they are monitoring the child, they are seeing it, not the child is doing for 10 minutes or 5 minutes. They are doing for more than half a day or one day. Continuously they are occupied with the same type of play or same type of behavior. Then the child is having some sort of problem of autism. For an example, pouring a water on the glass, or throwing the sand, or building a block, and they will be interested in one part of the toy. Always they will be interested in one part of the toy. So like that behavior the child is having, then we can conclude that child symptoms are related to the autism. early diagnosis has to be met. So these are the clinical manifestation that we can see on behavior of the behavior disabilities. Next, other clinical symptoms, like we can correlate with mental retardation also. 25% will have mild type of mental retardation. More than 70% of the child will have moderate to profound type of mental retardation. So that has to be early recognized. They will be dependent in all the activities. And another some of the other clinical manifestation, if the early symptoms are properly not managed or controlled, they can have the severe anxiety and depression problem. Anxiety and depression problem can be happen for the autism child. And they have the disturbances of gastrointestinal tract disturbances will be there. And they have the features of sleep disturbances, insomnia and sleep disturbances problem. And they have the obsessive compulsive disorder, repeated activity disorders, and attention deficit and hyperactivity disorders. So these are the some of the other features the child can develop with autism. And they can have the features of epilepsy. So in the causes, we can add the features of brain problem also. In the brain, the central nervous system also is affected due to the cause of increased serotonin level in the brain, and any defect in the temporal lobe of the brain and in the lymphic system. Any problem in the temporal lobe of the brain or the lymphic system, the child will be affected with the autism. And we can include one more factors in the causes, like psychological factors, like broken family, parental detachment, child is having a deviated personality disorders, and childhood separation, sibling conflict. So like that, psychological factors also, they can lead to this type of autism disorders. So this are the group of or clusters of symptoms they can see in the autism child. Each child is unique to each other. All the symptoms are not same for all the child. The symptoms will be varied from one child to another child. So as a healthcare professional, as a nurse, we have to find out what are the signs and symptoms that comes under communication disabilities, behavior disabilities, and social interaction disabilities and worsening problems. So we have to clearly define what type of signs and symptoms the child will get. Based on the child signs and symptoms, we have to see what unique features for each child. Then we can go with the behavior modification of the child. So I hope you have understood what are the clinical features. Next, we will see about what is the examination and investigation. Much medical investigations is not there for the autism child. Mainly examination is there. Here we can start with the medical history. Whatever the causes we told, that causes has to be asked in the history, like prenatal history, intranatal history. We can collect the mother, any infection is there, what type of delivery is there, baby have any preterm delivery, after delivery the baby, newborn baby got any encephalitis, meningitis, baby is having any sclerosis diseases, genetic type of any diseases, having any Down syndrome, Fragile X syndrome. Then we can ask any family member, family history having any problem. And next one is detailed examination can be done. Examination mainly growth of the child, head circumferences, chest circumferences, height, birth weight growth. This can be monitored regularly for the child. And the child can be assessed, some checklist of autism criteria can be assessed. Some questionnaires can be used to analyze the what are the problems or behaviors that are assessed for the child. Observation checklist or can be used for assessing the problems of signs and symptoms of the autism child. Then next, we can see the language development test, speech test can be done. We can see the growth and development of the fetus. Developmental test can be done. Behavior assessment can be done for the autism child. And for the brain functioning, we can see the EEG and we can see any problem in the temporal part or lymphic part of the brain structure. So these are the major examinations we can see for the autism child to detect any abnormalities or detect any early symptoms that is facing by the child. Early we are identifying the symptoms, we can treat and we can manage the disabilities and prevent the worsening the condition. Next, we'll see the what is the treatment that comes under autism child. Treatment may depend upon the therapies. And here comes pharmacological therapy also is there. Comparing to the pharmacological therapy, behavior therapy is good. If the child is having anxiety, depressions, compulsive disorder, obsessive disorder, or sleep disturbances, so like that time we can go with the pharmacological therapies like antidepressant, anti-anxieties, and antipsychotic drugs, mainly haloperidol and chlorpromazine. So like that type of drugs can be given for the child according to the age, according to the body weight. And serotonin inhibitors drugs also can be given for the neural function, central nervous system functions. Multivitamin supplement also can be given. So these all unique for the child and according to the symptoms, mild or moderate or severe or low functioning or high functioning. According to that, they can be given for the child. Main therapy is behavior therapy. Behavior therapies like self skill training therapy, behavior modification therapy, and we can reinforcement therapy can be given for the child. Applied behavior analysis. So behavior reinforcement is very much important. Each child is different from one another. We have to find the activities of the child and we have to go with the reinforcement, positive reinforcement, or punishment also we can give as a positive way. So when the child, we are asking the child put the play material in the box or connect the play material. So the child is not able to do, means if she or he is able to do, we can do the reinforcement. Not able to do, we can hold the hand of the child and we can make the child to do the procedure. So that will give a reinforcement for the child and we can monitor how effectively the child is changing the behavior by day to day. And another one is occupational therapy. Especially the child will be trained for some kind of works. Simple things like self skill training can be done. Self skill training, basic needs of the child of putting the dress, combing the hair, or putting the shoes. So like that, small type of behavior can be modified, teached. One by one can be teached. Or we can teach the child related their body parts. So what clothes they have to wear. So like that we can teach the child. And another one is speech therapy, communication therapy, verbal and non-verbal communication therapy can be done for the child. And last one is psychotherapy. Psychotherapy mostly we are not concentrating for the autism child. We are concentrating for the family members and the parents. Family members and the parents are very much important because they will feel frustration, guilt because I have this type of child, that is autism type of child. How I will overcome, how we will take care of the child. So this psychotherapy will be making the parents or the caretakers, they have a strong bond with the child. They will get so much of patience and they will get some of the educational intervention strategies or behavior modification, how to give or how to train the child and how to change the behavior of the child. So this can be taught to the parents based on the psychotherapy. And this child, when you see, they have a different features, that is idiot seventh skill will be there. So this type of child, they have some talents of skills, such as they can hear the music and they can memorize it very easily, and or sometimes calculation, they will be more interested in calculation, they will be more interested in mathematics, they will be more interested in memorizing the map, map or Indian map, what are the states. So like that, they can very fast, they can tell. So particular skills they will have. That skills will be very much sameness, and they will be used it very frequently, and they can learn very fast. So that skills can be identified, and they can be trained for the particular autism child. So their quality of life will be improved. So that is gifted by the God for this type of children, autism children. So this, as a nurse, we have to know about what are the different type of therapies that we can give for the autism child and autism family members. So behavior intervention therapy is very much important. Verbal intervention therapies, tactile interventions therapy, olfactory intervention therapies, that can be focused for each different autism child. Which child is needed for particular therapy, that can be boosted and tailored according to the need of the child, and that can be given. So this is the major management or treatment that comes under autism child. Then next we'll see about the nursing management. As an autism child or autism child is taking into the hospital or the centers, as a nurse we have to first step assess the level of the child, what type of level, whether it is a mild functioning or it is a low level functioning or high level functioning, what type of stereotypic behavior the child is having, what is the age of the child. Okay, so that we have to assess and understand clearly, and we can detailedly collect the histories and whatever the behavior observation for the autism child, that report can be collected and stored. And we can give a proper educational strategies for the family members how to take care of the autism child. What are the repeated behavior, what self harms they can get, what are the compulsive behavior, what are the anxieties, depression, what is insomnia, what is the sleep disturbances, what is mental retardation. So this is a cluster disorder. So different child have different symptoms. So what type of symptoms the child have, we can clearly teach the parents how to guide the child, how to change the behavior. So home itself not a center for changing. So we can find out different center for the autism child where they are getting a proper education. Education, it has to be specified and skill training type of education. So what from the basic needs can be taken, having a food or putting a dress, taking care of themselves, what skills they are having, what type of play, how to interact, how to communicate. So like that pattern, we can teach the family members and we can give the awareness. And when we are taking care of an autism child in any manner, so we have to one-to-one step has to be followed. One nurse has to take care of one autism child. Always they have to give the preference of the child. So what is the need of the child during the playtime, during the food habits, during the sleeping, or during giving medications. So the nurse has to take care holistically. So only the nurse cannot take, it is a multidisciplinary approach in giving care for the autism child. So group of therapists can be involved in giving a care for the autism child. So this is the major. And when this condition is worsening, what is the serious is going, so that can be monitored by the nurse. According to that, they can treat the child. Next, last one, we'll see what is the nurse's role. Nurse's role in prevention of autism. Prevention of autism, it is very difficult to prevent the autism. Only during the pregnancy time, proper antenatal checkup follow-up, and the pregnant mother has to be very conscious in their follow-up and prevent all the drug abuse, all the habits during the pregnancy. Any diseases, anything is there, they have to do the proper care. So based on that, we can prevent somewhat. Mostly we cannot prevent once the baby is getting with the autism disorder. We cannot cure the diseases. Only the disabilities can be controlled. So that has to be give awareness. So like this, on this World Autism Awareness Day, we can give awareness of autism. So many people don't know about the development of the child. So the child development has to be taught for the parents immediately after they are getting as a newborn. what are the development that happen for the child. So when they are monitoring the development, they can see any deviation in the development is there, they can find out any repeated behavior, repeated activity. The baby is not having any social mingling or social interaction, self-isolation, sameness, likeness of the play, or like that features they are identifying, they can report to the hospital or do the follow-up in the hospital. Or some children, they are considered as the high risk pregnancy. The baby is born as preterm baby. Baby is having some other genetic disorder, family history of autism child, on different kind of genetic problems, meningitis, encephalitis, like that cases of children, they can have a screening test of hearing or language or speech development, cognitive, that is a thinking. So different type of test or screening of autism checklist, so that can be monitor, and early we can identify the problem of autism. When we are early identifying the autism, we can have a interventions of therapies along with the medication also. Then we can control the symptoms going for worsening in their developmental stage. So most of the autism child, they will be growing and they will have a normal life in a mild level of lower level of functioning. If the higher order disorder, they have dependent in their family members or the parents till their end of the life. So as a nurses, we have a very much important role in giving awareness or intervention strategies to reach the level of all peripheries about the knowledge of autism. What is autism? What are the causes of autism? What is the clinical manifestation? How we can diagnose or do the examination on autism, and what are the intervention or the treatments or therapies that is present in the autism. Still the autism is going on so many research findings, how they can put the disease, how they can go with the different type of therapies, how they can manage the child. So hope in the future more therapies, more knowledge about the autism we will be getting. So on this awareness day, I'm very happy to stand in front of you to give a good message on autism child. It is one of a childhood psychiatric disorder. Here, developmental problems and disabilities of the communication, behavior, and social interaction happens. And we have discussed that more it is common in the male than the female, and this can be early identified in early age, that is of 18 months or 2.5 to 3 years. Late, if it is coming, it is known as the late childhood autism disorder. Next, we have seen about the causes mainly of unknown etiology, hereditary, genetic features, chromosomal abnormalities, environmental features, and psychological factors, and neuron problems, central nervous systems like increased serotonin level, and they have any temporal lobe problem or lymphic system problem, then the child are risk for getting the autism. Next, we have seen about the clinical features, mainly of communication related clinical features, social interaction related clinical features, and behavior related clinical features. Behavior, mainly they have sameness, likeness, repetitive, stereotype type of behavior or play. And we have discussed about the seventh type of sign, that is a special skill that is get for the child of remembering or calculating or hearing music or like that futures the child will have. And we have seen about the examination, mainly medical history. The next one is examination of the baby, different type of test. Next, we have seen about what are the treatment modalities, pharmacological therapy and behavior therapy, applied behavior analysis, occupational therapy, skilled training, and psychotherapy. Next, we have seen about the nursing management and nurses role. So you very well, you have listened the online classes. Hope you have understood the class. Again, I will meet you on another section from our channel rgcsk.edu. Thank you.